Well, look, we've heard it all before. You know, all the major networks are now coming out with this idea that we're basically just a nation, basically consisting of more than 65 or 70% of the people, that we're all just a bunch of whiners, and that some of the whistleblowers on there can just blow away. Okay, that might actually happen if we don't take care of what is going on. So I'm going to mention another whistleblower on here, actually a former insurance industry insider. His name is Wendell Potter, and I'm going to post a link to his essay. You should read the entire thing because, you know, my video is only going to be like 10 minutes long or something, but it's worth listening to. And so here it goes. I'm the former insurance industry insider, now speaking out about how big for-profit insurers have hijacked our healthcare system and turned it into a giant ATM for Wall Street investors, and how the industry is using its massive wealth and influence to determine what is and what is not included in the healthcare reform legislation the members of Congress are now discussing. Although by most measures I had a great career in the insurance industry, 4 years at Humana and 15 years at Cigna, and you will notice this guy is actually mentioning names, in recent years I had grown increasingly uncomfortable serving as one of the industry's top PR executives. In addition to my responsibilities at Cigna, which included serving as the company's chief spokesman to the media on all corporate and financial matters, I also served on a lot of trade association committees and industry finance coalitions, many of which were essentially simply front groups for the insurance industry. So I was in a unique position to see not only how Wall Street analysts and investors influence decisions insurance company executives make, but also how the industry has carried out behind-the-scenes PR and lobbying campaigns to kill or weaken any true healthcare reform efforts that threatened the insurers' profitabilities. I've also seen how the industry's practices, especially those for the for-profit insurers that are under constant pressure from Wall Street to meet their profit margins, have contributed to the tragedy of 50 million people being uninsured, as well as to the growing number of Americans who, because insurers now require them to pay thousands of dollars out of pocket before any kind of insurance actually, in reality, kicks in, are totally underinsured. This number is growing by the month, and it is now at the very least an estimated 25 million and constantly growing. As an industry spokesman, I was expected to put a positive spin on this trend that the industry created and euphemistically calls consumer-driven healthcare. I ultimately reached the point of feeling like a huckster. I thought I could live with being a well-paid huckster and hang in there a few more years until I could retire. I probably would have if I hadn't made a completely spur-of-the-moment decision a couple of years ago that changed the direction of my life and my outlook. While visiting my folks in Northeast Tennessee, where I grew up, I read in the local paper about a health expedition being held that weekend a few miles up US 23 in Wise, Virginia. Doctors, nurses, and other medical professionals were volunteering their time to provide free medical care to people who lived in the area. What intrigued me most was that Remote Area Medical, a non-profit group whose original mission was to provide free care to people in very remote villages in South America, was organizing the expedition here. Nothing could have prepared me for what I saw when I reached the Wise County Fairgrounds, where the expedition was being held. Hundreds of people had camped out all night in the parking lot to be assured of finally seeing a doctor or a nurse or a dentist when the gates opened. By the time I got there, long lines of people stretched from every direction around every animal stall and tent where the volunteers were working. The scene was so visually and emotionally stunning, it was all I could do to hold back tears. How could it be that citizens in the richest nation on earth would have to stand in line for this? A couple of weeks later, I was boarding a corporate jet to fly from Philadelphia to Connecticut. When the flight attendant served me lunch on a gold-rimmed china plate and gave me a gold-plated knife and fork to eat, this is when I realized for the first time that someone's insurance premiums were paying for me to travel on that jet and in total luxury. I also realized that one of the reasons those people in Wise County had to wait in long lines to be treated in animal stalls was because our Wall Street-driven healthcare system has created one of the most inequitable health systems on the planet. And of course, he goes on and on to say, and take it from me, a former insider who knows what really motivates those folks. You need to know where the hard-earned money you pay in healthcare insurance premiums actually goes, if you're lucky enough to even have a policy at this point. So please read the essay. I'll post a link to it. And of course, I can already anticipate some counter arguments here, basically saying, well, it's easy for this guy to come out now and speak because he's already retired. He's made his money in the industry. This is true, and it's a valid argument. But you should also consider that some of these people can actually be our allies. And it's not the first time that insiders and whistleblowers have spoken out because they really intrinsically changed their mind and spoken out on behalf of a different concept. One example probably would be, Daniel Ellsberg, who of course took much greater chances as a whistleblower, coming out with the Pentagon Papers and so on, because his life was actually threatened when he did that. And to this, I would also add another example, Bill Moyers. Okay, Bill Moyers was the PR man, the press secretary for Lyndon Johnson, and he has also made a huge turnaround and has, in the years after, worked for the greater good and questioning the legitimacy of government policies. We have to, give some credit to these people, and don't dismiss them entirely. We're all whistleblowers, and we should all be blowing our whistles very, very loudly by now. Good night.